61.2% of people in my birth fears study were worried about pooping at delivery. So today I'm going to tell you how to avoid pooping at delivery, what you need to know about it, and what to do moving forward. Now, I see a lot of people talking about, oh my gosh, I'm so afraid the nurses will just clean it up. But there are a few things that you can do to avoid pooping at delivery. So I just want to give you those tools in advance, which is why you want to learn from an expert. Hello, I am Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I've cleaned up a lot of poop in my time, but I've also seen people who didn't poop. And I know some secrets to try and avoid it at your upcoming birth. Now, if you're getting prepared for your hospital birth, I'm your girl. I've delivered tons of babies in the hospital and I really understand what goes there. I actually have my best tips for labor that you guys can grab down in the comments so that you can get started preparing for your upcoming hospital birth. And if you want all of my best tips, come join me in the online prenatal class for couples, the easy way to get prepared for your hospital birth. Okay, the biggest question is, how common is it to poop while you are giving birth? And I'm here to say very common. We got to realize that in your pelvis, these are large muscle groups, okay? It's not like your finger where you can just move one muscle, large muscle groups, so that when you use these muscles, they all activate. So it is really difficult to try and push a baby out of your middle hole, also called the birth canal or the vagina, and not move things out of your rectum, also called your poop hole. So that is why you might poop during birth. Again, let me be very clear. It is something that your nurse has taken care of before. In fact, poop in general is something that your nurse is very well aware of. We start in med-surg, which is something you handle all of the time. In fact, your little bits at delivery are a whole lot easier than anything we've experienced in other areas of the hospital. So we don't want you to feel uncomfortable about it. If you're watching this video thinking you can 100% avoid it, I'm here to tell you you can't really, but there are a few things you can do. Okay, the biggest one is to go into labor naturally. If you come in for an induction, your body has not done any of the prep work ahead of time to get your intestines cleared out before you go in to have your baby. However, a lot of people say that one of the signs of labor is GI distress, which often includes some diarrhea. Now, that totally makes sense. Your body is going to think, I want to clear out that area to give baby the most room as possible, and I also don't want to expend a lot of energy digesting food when I'm going to need to be having a baby. So going into labor naturally does decrease your chances of pooping at delivery. However, let me remind you that not everybody gets the option to go into labor naturally. Some of you may have serious things happen that require an induction, and some of you may just choose to have an induction, which is totally fine. And I'm here to say that even if you go into labor naturally at home, sometimes you still end up pooping at delivery, and that is a-okay. Okay, let's talk about what you're eating in those last few days or weeks before you go in to have your baby. I would just encourage you to increase your fiber intake. The best things to do that are legumes like beans, vegetables, fruits. Fruits seem to have the most fiber, and I think they're discounted a lot. Now, if you're diabetic, talk with your dietitian about the best sources of fiber that you can be using towards the end of pregnancy. But if you are not diabetic, be sure and include some great fruits. Raspberries have a ton of fiber, blueberries, kiwis, especially if you eat the skin, although I don't know that I can do that. But increasing your fiber intake will decrease your chance of constipation. And honestly, that is a big win after you have your baby as well. That first poop at delivery can be really tricky. I want you guys to be prepared for that. I have a whole post on it. I'll put it down in the description. One of the things you can do to really increase your fiber intake is dates before delivery. And did you know that dates can actually soften your cervix before you go in to have your baby? So dates can be a real win. Of course, if you're diabetic, check with them. The good news is things that are more full of fiber generally are a little bit better on a diabetic diet. But again, it really depends on how your sugars are looking and what you respond to. So talk with your dietitian. But dates are one of the things you can do to prepare your cervix before labor. I actually have a whole video on 4 things you can do to prepare your cervix before labor. You guys can check it out right here. Now, some people are going to say, Hilary, can I do an enema at home before I go in to have my baby? And I'm going to say, sure, you could. We actually used to give enemas at the hospital while you were in labor to eliminate this situation. However, sometimes we would get the poopy after effects of that. And pretty much by the time I started in labor and delivery in 2001, we had stopped using enemas during labor. However, if you're super concerned about this, please talk with your provider. You can ask them if an enema at home would be okay with them. Although in general, we don't recommend recommend enemas. It kind of messes up your GI system. And so I would try and avoid it if you can. Plus, you don't know if you're going to evacuate all of your bowels and that enema at the time, or if you're going to end up having diarrhea in the hospital. And I do not want that for you. Labor is miserable enough. We don't need to add our own problems to it. Okay, some of you may wonder, will my partner know if I pooped at birth? They might. Now, usually what happens is as you're pushing, your nurse is going to just put a washcloth down there and we're just going to wipe it off. And then every little bit, we're just going to change the washcloth. Something you can do if you're really worried about it is you could bring a little air freshener. Usually in the hospital, we have some air freshener, but you can bring some if you want to. And you know the sign of a good partner when they see it and they say absolutely nothing about it, because they understand that a lot is going on right now. A lot of Mother Nature is in that room and they need to keep their mouth shut about it. Now, one other thing that you might find interesting is that baby can actually poop either while in the womb or at delivery. Baby pooping is called meconium. If it happens while they're in the womb, it's not our favorite thing, and we might call a neonatologist in the room, but you got to remember you're not the only one who's pooping in this scenario. My second baby, he came out pooping everywhere, and I was like, clean up on aisle 2. Now, we've talked all this bit about pushing. You might want to know more about pushing, so check out this video right here.